Okay, the last tab we're going to look at is the Review tab. And again, you'll notice everything's turned orange across the top. You have new tabs down the left side. A lot of people tend to kind of ignore the Review tab, but it is very important. It lets you go back and review key information. So for example, it lets you look at your crew, see if you've made any mistakes. It gives you a time summary, and I did not put all these times in, but you'll notice down through here, it gives everything that has been listed, interventions, transport times, dispatch times, intervention times, all that sort of stuff, and lets you go down and review all of that. You also have, and I'm going to skip the print preview here for a second. You have the narrative, again, which is very important. This is free typing text. Things to put in the narrative are things that don't fit in the checkboxes. But keep in mind that the things that fit in the checkboxes, such as your assessments, your interventions, how much oxygen you gave, for example, needs to be in the checkboxes, because the narrative is not searchable. When we run reports, the narrative is not searched. So if you put that you intubated the patient in the narrative but not in the interventions, then it's not accessible with the reports. So anyway, the narrative, you can type whatever you want here. You can view your ECGs that you might have imported. There's a survey right here, which we're not using at the present time. Once this is all done, you can look at the print preview. It will load that into a window, and it may take just a short time to do that. So here's the run report, and again, this is difficult to see. You can increase the size of it with this, and you can use your scroll bar to scroll around and to scroll up and down and look at this as well. And you can see exactly what your run report is going to look like. Here's our annotation that we made. So that's included with the run report, our assessment, trauma scores, vital signs, anything that is imported with the X series monitor is shown here. So this is just exactly as the run report is going to be submitted. So you can check it to make sure it's complete, make sure all the information that you want is there. You can also print it out with this button over here. You also have buttons over here to decrease, increase the size as well. So very important. If you find that you've missed some information, you can go back over here to the patient, for example, or whatever tab it's from, to put that information in there.